Good day. My name is Kendra Kern and I am reporting to you from CIS News. Today we will be covering a story that is quite creepy, if I might say. Herpes simplex. It is a viral disease caused by both herpes simplex virus 1 and herpes simplex virus 2. Infection with the herpes virus is categorized into distinctive disorders based on the location of the infected area. Oral herpes, otherwise known as cold sores, is the most common form of the infection, while genital herpes is the second most common form. There are many other forms of the infection, some of which we will be covering in today's broadcast. The word herpes comes from the Greek word herpeon, which means to creep. Just as the definition implies, the herpes simplex virus is quite transmittable and has become very prevalent in the US and around the world. Herpes simplex is most easily transmitted through contact with the virus-rich liquid that the sores and lesions of the infected areas contain. The virus cycles through active phases. Blisters and lesions filled with the infectious liquid appear for anywhere from 2 to 21 days, followed by a remission stage. But even in the remissional stage of the disease, transmission may occur through skin-to-skin contact during the asymptomatic shedding. While the cause of the reoccurrences is undetermined, some potential triggers have been identified. In most cases, the frequency of the active disease phase does reduce over time. Sadly, there is no cure for herpes simplex in any of its forms. There is no vaccine at this time, but there are a number of vaccines that are in the advanced stages of trial. While the virus cannot be cured, there are treatments to help reduce viral reproduction and to alleviate the severity of the symptoms. Now, we will be going to Suzette, who is reporting live from Aurora.
This is Suzette, reporting live from Aurora. In the world today, 85% of the population is infected with one of the herpes viruses. The genital herpes infects 20 to 25% of American adults and teens, while over 60% of adults are infected with oral herpes, most cases being contracted during childhood. Many times the carrier shows no symptoms and does not even realize they are infected. You may ask yourself, why is this so dangerous to me? The virus is very contagious and incurable. Oral herpes is transmitted through the respiratory or oral secretions and often found around the lips and mouth, while genital herpes is transmitted through secretions during sexual contact and found in the genital area. It can live outside the host body for hours, and in some cases it's contractable from skin-to-skin contact. What should you look for? Once the virus has been contracted, it enters the nuclei of the cell and tries to replicate itself. Sometimes during this process, the virus destroys the cell it has invaded, causing an outbreak of ulcers and or blisters looking like this. These blisters are filled with fluid that is rich with the virus. It usually takes anywhere from 2 to 20 days after being exposed and referred to as primary herpes, all other outbreaks being referred to as recurrent herpes. Some other symptoms that may accompany primary herpes are fever, pain, tingling, and swollen glands days before an outbreak. Where does the virus go between outbreaks? It lies dormant in the dorsal root ganglion of the 5th cranial nerve, where it waits, not replicating, for a stimulus such as stress, infections, and even sometimes something as simple as a sunburn to reoccur. Recurrent herpes generally occur at or around the original infection site. While both strains of the virus are very different, they do present themselves in the same way, and an overall outbreak lasts 2 to 3 weeks. Back to you, Kendra.
Thank you, Suzette. Now we will be going to Cami, who is at the Arden Healthcare Center.
Thanks, Kendra. The scene at Arden Healthcare Center is a somber one. An outbreak of herpes whitlow, otherwise known as finger herpes, has occurred. Herpes whitlow is caused by the herpes simplex virus, usually via a torn cuticle, which the virus then invades the dermis and subcutaneous tissue, and infection occurs within a few days. These lesions can often be painful and at times disabling. Generally held to be an occupational risk for healthcare workers, whitlow can also occur via thumb sucking in children and also as a secondary cause of genital herpes. Preventing self-infection is simple. Do not touch any infected areas during an outbreak. If you do, make sure you wash your hands with soap and warm water. Back to you, Kendra.
Thank you, Cammie. Now we'll be reporting live with Allison at the University of Oregon.
Hi, I'm standing outside University of Oregon where there has been an outbreak of herpes gladiatorum. The word gladiatorum is an adjective meaning wrestler-like. I bet you can guess what group of college students that affects. The wrestling team. Also known as mat herpes, this virus spreads easily with all the skin-to-skin contact amongst wrestlers. The sores are filled with fluid, and when ruptured, they spread to other wrestlers. The important thing to understand is that herpes never leaves the body. It may go into hiding, but at any moment, something could trigger the virus to reactivate. The board will be meeting tonight to discuss the fate of one wrestler. The one who is said to have started this outbreak could be kicked off the wrestling team indefinitely. Until further notice, all wrestling practices and matches have been canceled. This is Allison reporting live from University of Oregon. Back to you, Kendra.
Thank you, Allison. For all massage practitioners in the state of Washington who may be tuning in, it is good to know that for herpes simplex, massage is locally contraindicated in the acute phase. However, there are many benefits to massage. In general, it helps to boost the immune system, which may reduce the outbreaks of herpes simplex. Thank you, and have a nice day.
Does herpetic psychosis get you down? Does the itchy lesions in your she-beard make it hard to get a date? Well, do we have the product for you? Introducing Killacreep, a shaving cream for beards of all genders. Killacreep will give you the most comfortable, refreshing shave you can get. It protects against leakage of herpes lesions. It will give you a conditioning sensation that you can actually feel.
Killacreep may cause anal leakage, coughing, sneezing, headaches, dizziness, explosive diarrhea, nausea, watery eyes, loss of sensation, tingling, bloating, indigestion, erectile dysfunction, fever, severe depression, menstrual cramps, itching, decreased appetite, drowsiness, increased sweating, fatigue, trembling or shaking, abnormal dreams, changes in vision, chest pain, constipation, dryness of mouth, hot flashes, frequent urination, hair loss, weight gain, anxiety, restlessness, and breast enlargement. Please consult your physician before usage.
Killacreep! Thank you, Allison. Thank you, Allison. For all of you massage practitioners who are tuning in, it is good to know that
With HSV1 or oral herpes. Okay, stop. Stop. Oh my god. Tell me you got that on tape.
Wow, I stopped.
Three, no, four, no.
Maybe you should do that part.